In the heart of Edo, Nigeria, a significant challenge emerged. A severe outbreak of diphtheria threatened the lives of many. Diphtheria, once thought to be under control, reared its head with a force that demanded swift and decisive action. This is the story of two dedicated epidemiologists, Dr. Odion and Dr. Essie, from one of the government hospital's community health department, who rose to the occasion. As news of the outbreak spread, panic gripped the communities. Parents feared for their children, and hospitals began to overflow. Dr. Odion, a veteran epidemiologist with years of experience in infectious diseases, realized the gravity of the situation. Partnering with Dr. Essie, a brilliant young epidemiologist known for her innovative approach, they formed a dynamic duo with a peer-reviewed plan. Their first step was to investigate and confirm the diagnosis as diphtheria and as an outbreak using the NCDC and the WHO guidelines, activate the state EOC and the institutional epidemic response teams in all tertiary and secondary health facilities across the state. From there, they coordinated efforts, working tirelessly with all stakeholders, public health experts, community health workers, local chiefs, heads of households, epidemiologists, pediatricians, NCDC and WHO teams in Edo State and Nigeria. They ensured resources such as diphtheria antitoxins and antibiotics. Trained healthcare workers, vaccines, and other treatment resources, including public health campaign supports, were allocated effectively. They initiated a massive public education campaign using the NCDC, WHO, and institutional campaign materials, flyers, role plays, sensitization at strategic points such as schools, PHCs, religious meeting places, and health facilities. Sensitization, training of all stakeholders, provision of antitoxins, antibiotics, and DTaP and other NAFDAC-approved vaccine combo, according to WHO recommendations, became the cornerstone of their strategy. The duo ensured that pregnant mothers also received their recommended doses, and the expanded program on immunization was followed at all health facilities in line with WHO recommendations. The tide began to turn when all stakeholders directed the interventions, without waiting for Drs. Odion and Essie. Slowly, the number of new cases began to decline. Words of hope replaced whispers of fear. The communities rallied together, supporting one another, and with each passing day, the epidemic's grip loosened. Through collaboration, education, and sheer resilience, Dr. Odion and Dr. Essie not only managed the outbreak but conquered it. Their story is one of dedication and unity, showcasing the incredible power of the human spirit and collaboration in the face of adversity. As the dust settled, Edo stood tall, a testament to what can be achieved when science, compassion, and determination come together for a common cause.
Distinguished Traditional Council, Your Excellency, the Executive Governor of the State, Honorable Commissioner for Health, esteemed members of the State Cabinet, respected religious leaders, renowned experts, captains of industry, honorable school teachers, revered community elders, dedicated health workers, and esteemed members of the diplomatic corps, members of the public, ladies and gentlemen, we greet you with respect and humility. The sickness with them they call diphtheria no be ordinary cough. If it kill pikin or adult, if we no act fast. Diphtheria wahala they show start 2 to 5 days after person catch am. Signs where fit show include big grey cloth covered throat and tonsils, sore throat, and voice like frog swollen gourd. big lymph node. For neck breath, no they come easy or they run like goat, nose they leak, hot body and shivers, waka tire. Some people will catch diphtheria bacteria no go, even sabi say them sick, or them no fit show sign at all. Them wey no sabi say them they sick na the diphtheria carriers. Now why them they call them carriers? Because them fit spread the yawa without gree catch the wahala. Diphtheria signs them start to jolly 2 to 5 days after person done catch them. Signs fit include diphtheria na wahala way come from bacteria way them call Corynebacterium diphtheriae. This bacteria they party for the throat or skin area. See, diphtheria they waka through airdrops where they fly around. When person wey don catch sneeze or cough, it dey drop contaminated droplets where people fit inhaler. Diphtheria they spread like wildfire for crowded place. Contaminate things which belong to infected person. Sometimes people catch in because them handle things we don't touch infected person, like use tissues or hand towels were full of bacteria. Touching wahala wound fit carry the bacteria too. People we don't catch the diphtheria bacteria and no get treatment fit pass. To others we no chop the diphtheria vaccine, even if them no show signs. Risk factors now, small pikin and adults wey no get correct vaccines, people where they live for crowded or dirty areas, and anyone where they travel to place where they get plenty diphtheria wahala. Before them bring antibiotics, diphtheria they chop young pikin well. Today the sickness they treatable and preventable with vaccine. Diphtheria vaccine they usually join with tetanus and whooping cough, pertussis vaccines. This 3-in-1 vaccine them they call diphtheria, tetanus and pertussis vaccine. The latest version are DTaP for pikin and Tdap for teenagers and adults. We dey thank God say state government don't provide vaccines and other resources. We don't also gather emergency resources and toolkits where go help manage the sickness and all the gist way they around Na so we dey use this medium spread the awareness. Make we tell our people say this sickness they waka from person to person through cough and catarrh. The cure and prevention they ground. Na vaccine be the key. Make we join hands to vaccinate our children, avoid contact with the sick, recognize early symptoms like sore throat and breathing difficulty, and go hospital sharp. E no get tribe, e no they choose religion. Now together we go stop on. His Excellency, my respected and highly elders, now is the time for unity in action. Let Edo State rise again as an example of health, wisdom, and care for all. Pa Obulu, thank you. Now the media unit of our community medicine department, Irrua Specialist Teaching Hospital, Irrua, bring una this message.